Hello, my dear viewers. Welcome to another episode on Dr. B's channel. Like I always say, this channel is for you. This channel was created to promote health, give information on health in an easy to understand way without the medical jargons, in a way that helps you to make the best decisions for your own health, because your health is one of the greatest components to living a full and good life. And that is my ultimate goal. I want each and every one of us to live a full and good life, but you can't achieve that without optimal health, because your health is your greatest asset. So if you are first time on this channel, kindly subscribe, click the notification button so you can be aware when there is another episode on this podcast. And if you like it, share with a friend and encourage them to subscribe as well. Today, I want to talk about diabetes. Diabetes, we hear it a lot. It's pretty common now in the population, and it's something to watch out for. And today I want to make diabetes as simple as possible for everyone to be able to understand. What exactly causes diabetes? What is this diabetes about? Is it because I eat too much sugar? You blame yourself, oh, I'm diabetic because I eat a lot of sugar. It is in a child, the mother is blamed because she always ate too much sugar or something like that. Today you're going to have better understanding. In the normal body process, there is digestion. And during digestion, complex sugars, as we call them, are broken down into glucose so that the cells in the body can take them. So there is digestion of complex sugar into glucose, and then glucose in the blood. This glucose is released into the blood, and glucose in the blood is then transported into the cells. The cells are the units of our organs and tissues that keep us alive. So the cells have to be optimal. And to be optimal, they need glucose to do their work. Glucose wouldn't just go to them. Insulin is the transportation that carries glucose from the blood into the cells. I hope you understand that so far. So insulin is that link between the blood and the cell that carries glucose. So diabetes is a disease where there is a problem with the processing of glucose in a particular person. So there's digestion quite all right. The sugar, the complex sugar that we get from various foods is broken down into glucose quite all right. But insulin is either not available or inadequately available to carry glucose into the cell. That's a simple way to try to break it down. In type 1 diabetes, because we have two types medically in medical classification, type 1 diabetes is there is no insulin at all. It's missing. So to help the person with type 1 diabetes, there has to be insulin transferred into the person externally, because for some reason, the pancreas, which is the organ that produces insulin, is unable to produce insulin. That is type 1. It is commoner in the younger age group. It's often genetic and is associated with some other forms of diseases, but I'm not going to bore you with that detail because I don't want to distract you from the main intention of this talk today. Type 2 diabetes is diabetes in the situation where insulin is not sufficient, or there is what we call insulin resistance. So insulin is produced by the pancreas, but some other things are going on in the body that is resisting the function of insulin. So the person is producing and pumping insulin, so insulin can carry glucose into the cell, but something says, no way, I'm not going to let you do your job. And so because there is resistance to insulin, insulin can't perform its job, the glucose stays in the blood. Now, there's a problem with glucose staying in the blood, right? Because that's not where it's supposed to be. Glucose is not supposed to stay in the blood. That causes some problems. And those are some of the problems we see in the symptoms that manifest in diabetes. The cells, on the other hand, are waiting for glucose so they can function. But guess what? They are disappointed. They are starved and they start to die because they need glucose to live and to perform their function. But they don't get the glucose. So whether type 1, whether type 2, there's a problem with the transport of glucose from the blood to the cells. And because of this established problem, there's a problem going on at the cellular level because the cells are starved and they cannot do their job and they might die. On the side of the bloodstream, they're screaming for help because there's too much glucose in them, and that's not the way they are wired. So I hope we got that straight. So don't be confused about diabetes anymore. So whether type 1 or 2, none of it is good. But the good thing is both are manageable. Now we all have some other conditions that we call pre-diabetic and gestational diabetes. Pre-diabetic is a condition in which diabetes is not yet established. The glucose level is pretty high, but not high enough to be diabetic. And in pre-diabetic conditions, you can actually prevent diabetes because it entails lifestyle modification. Usually the doctor or the endocrinologist will counsel about more exercise, cutting down on what we call refined sugars, those ones that they shoot up the blood glucose drastically. So they want you to cut down on refined sugars and all of those things. You will get the details when you see your physician. That is the pre-diabetic condition. Pretty well manageable with lifestyle modification, with modification of your nutrition, following the counsel basically that your physician is going to give. Gestational diabetes happens when a woman is pregnant. Most times it clears off after the baby is born. Some things are going on in the woman's body and it's just difficult to transfer the glucose from the blood into the cells when she's pregnant. But once the baby is out, she needs to be monitored. Many times they will revert and become non-diabetic, but in a few cases they might still have challenges with controlling that blood sugar, and they are a special they are special category because the baby that is born needs some special kind of care because of the situation of hyperglycemia, which simply means high level of glucose in the blood that the child, that because of a mix between the mother's blood and the child's blood, there are some manifestations immediately after birth, but the medics know what to do. So a woman with gestational diabetes should have a baby in the hospital that has the facilities to take care of all those things. Now, I would round up with the symptoms of diabetes. Weakness. And sometimes, especially in Nigeria, where I'm originally from, I'm a proud Nigerian, by the way. Any weakness is always malaria. it's almost like non-negotiable. Once someone is weak, easily tired, it's malaria. It's not always malaria. Sometimes that might be the first sign that there is diabetes. Another thing is frequent urination. Another thing is thirst. And then sometimes some manifest with some degree of feeling very hungry. How do you check whether you are diabetes or not? Like I've said in some of my previous videos, these are some of the things that will be done during an annual wellness check. So during an annual wellness check, your blood glucose is checked. Many times they ask you to come fasting so they can check your fasting blood sugar. Your fasting blood sugar should be less than 100 milligrams per deciliter. That is the measure. If you are fasting and you're not diabetic, it should be less than 100. Sometimes if it's 2 hours after you have eaten, it would be higher than that, but there's also a range for it. And the doctor interpreting your results will be able to tell you. Maybe you've not done your annual wellness check and there's history of diabetes. Like I always say, when some things occur in the family, it's better you watch out so you can prevent it. If you have a dad or a mom, or there's just a lot of people in the family with a history of diabetes, please do this check. You do yourself good by doing this check. Because guess what? Like I told you, over time, too much glucose in the blood and the cells being starved of the glucose they need to do their job creates damage in the body. And like I tell people, diabetes is beyond just having too much glucose in the blood. It's a systemic disease because it can affect the heart, it can affect the eyes, it can affect the limbs, it affects the nerves, it affects everything. Think of it. It destroys organs. So sometimes uncontrolled diabetes is why people start to go for dialysis. It's as bad as that. But this builds over time and we can prevent that. And if you've been diagnosed to be diabetes, it's not the end of the world. You shouldn't panic. You shouldn't run from pillar to post looking for, oh, there's this herb here. Like I say, please verify things before you use them, because you don't want to create more problem, damaging your liver or damaging your kidneys because you're just scared because you've been diagnosed to have diabetes. It's not the end of the world. There are top-notch management for diabetes now. Even insulin shots like we used to have way back in those days, now we have insulin patches where people don't have to give themselves the injections at regular intervals and hours. So diagnosis of diabetes is not the end of life. It is the beginning of good life if you choose the good life. And I trust you're going to choose good life. I hope this has been helpful. Please share with friends, share with people that might be having diabetes and are not sure of the next step to take. If you have any questions, post in the comment section and I'll be happy to address them. Remember, your health is your greatest asset. Until the next episode, I remain Dr. B. Bye for now.